Hello, good morning, dear students. Homeopathy, the most scientific system of medicine. In today's lecture of Materia Medica, I'm going to take a lecture on phosphoric acid. Phosphoric acid, the formula H3PO4. This is the formula, and I hope you're not coming across the name of phosphoric acid for the first time. You already have learned it in your previous classes of chemistry, and today you are going to study the homeopathy of phosphoric acid. Phosphoric acid, also known as orthophosphoric acid or phosphoric 5 acid, is a weak acid with the chemical formula H3PO4. It is normally encountered as a colorless syrup of 85% concentration in water. The pure compound is a colorless solid. Phosphoric acid is a colorless, odorless crystalline liquid. It gives soft drinks a tangy flavor and prevents the growth of mold and bacteria, which can multiply easily in a sugary solution. Most of the soda's acidity also comes from phosphoric acid. So, my dear student, we have been consuming, people around us have been consuming phosphoric acid in the form of soft drinks and sodas. Food grade phosphoric acid is used to acidify foods and beverages such as various colas and jams, providing a tangy or sour taste. Soft drinks containing phosphoric acid, which would include Coca-Cola, are sometimes called phosphate sodas or phosphates. Phosphoric acid in soft drinks has the potential to cause dental erosion. Phosphoric acid also has the potential to contribute to the formation of kidney stones, especially in those who have had kidney stones previously. So, as I said, people around us have been consuming phosphoric acid in the form of soft drinks, particularly Coca-Cola. So, it will not be strange to find the patients who need phosphoric acid as homeopathic remedies. A link has been shown between long-term regular cola intake and osteoporosis in later middle age in women but not in men. This was thought to be due to the presence of phosphoric acid, and the risk for women was found to be greater for sugared and caffeinated colas than diet and decaffeinated variants, with a higher intake of Coca-Cola correlating with lower bone density. So, phosphoric acid can damage the bones and can lead to osteoporosis if it is taken in extra amount or if a patient is sensitive to its intake. The dominant use of phosphoric acid is for fertilizers, consuming approximately 90% of production. So, not only that, phosphoric acid is being used in soft drinks and sodas, but at the same time, it is also used in fertilizers. So, coming to homeopathic part of phosphoric acid is also called as glacial phosphoric acid. And next is ailments from or complaints in phosphoric acid are caused by loss of vital fluid and sexual excess is the main cause of phosphoric acid patients suffering from the symptoms. So, my dear students, as you know that since last few lectures we have been dealing with or discussing, or I have been taking the lectures on acids, and today's acid is one of the very important acid you have. And here you can see the causes of phosphoric acid complaints are loss of vital fluids, especially in the form of sexual excess. The complaints also appear or are caused by violent acute disease, as well as the complaints are caused by chagrin in the sense anger. The complaints are also caused by care and grief, sorrow, separation from home. Sorrow as well as complaints are caused by separation from home. Now here let me tell you that phosphoric acid is one of the remedy for homesickness. One of the our PG had taken the dissertation topic as phosphoric acid for homesickness, and she has found very good results in especially girls or students who have been staying in hostels far from their house. They suffer from phosphoric acid complaints because of homesickness. So phosphoric acid is one of the remedy for homesickness also. Complaints are also caused by disappointed affections, are also caused by shocks. And not only that, complaints can be caused by overlifting, overstudy, and then long succession of moral emotions in injuries and operations. It is also one of the remedy for complaints which are caused by bad news and disappointed love and drug abuse after illness. Yes, phosphoric acid is one of the causation of each and every remedy is very very important. And here let me just tell you how important the causes are. And I selected in fact a remedy for a patient who was 20 years old boy, a 22 years old boy who came to me. I selected the remedy phosphoric acid only on the basis of causation. His individualizing symptoms were hidden in the causation, and believe me, he was recovered of all his complaints. And the patient was brought by one of our intern only. He was 22 years old and he was brought for a hair loss problem and baldness. So he came to the OPD with history of hair fall, and he removed his cap and showed that he is suffering from baldness. So as we treat in homeopathy even cases of hair fall as well as any other skin complaints etc., by not only giving a remedy which is based on only the local symptoms but in general considering the patient as a whole. So since he was suffering from chronic hair loss, I had to take a chronic case history. And as soon as I started with the cases, he thought that here it is hair and skin OPD, so he will be just given some external application and some medicine and some vitamins to uh, get his hair fall treated. But when I started asking him since when it started, and then when I asked, do you suffer from any other health problem than hair fall? Then he was staring at me. Staring look of his eyes I cannot forget now also. In fact, the patient was, 2 to 3 years, or I think 4 years back, I have treated him. And then he told uh, that I'm suffering from many other complaints, doctor. You are supposed to give me the treatment for hair. Then I said, no, we treat the hair fall from giving the oral medicines, not only external medicines. And for to give that oral homeopathic medicines with which you will be cured of your hair fall, I told him that we need a very clear case history and including your mental symptoms and your past history and then any other health problem you have. Then he sat down that time. Otherwise, he was standing only. Then he sat down and then he asked me to, all other two of the interns were sitting next to me, and he told me that please, keep them outside, send them outside. Then I sent them. They were sitting outside. Then I asked them to sit outside. Then he said, see, I am giving you a case history. Whatever you are asking, I am going to tell, but on only one condition. Then I said, what is that? You have to keep it confidential. I said, for a while, I got scared because he was very hefty, tall and hefty. I got scared. He should not hit me on my head. So because he was having those bulging eyes and red eyes, then I told him, okay, fine, I will not share it with anybody. I told him, and I told him, see, doctors keep their, actually I'm sharing with you, I'm not disclosing the name also, but I'm sharing with you because I want to teach you phosphoric acid. So don't just think that as a story. Try to learn materia medica from this patient's case history who just came to me with hair fall problem. Right? And when I started asking him the question, he said, see, the main complaint with which I am suffering is since last 2 years I have not slept. Since last 2 years I have not slept. I said, what? 22 years? You have not slept? Yes. Sometimes nowadays I'm taking 10 sleeping pills. Don't tell anybody, he told me. And then I'm taking those pills without my anybody's knowledge. Then I said, why are you suffering from this sleeplessness? Then he started with the case history. The history he told me, story he told me that actually he and his friend were working on some project of starting a B.Ed college in Belgaum. And then they were in that process. So for that they had to go to Bangalore. And in Bangalore, unfortunately, his friend fell ill. And he fell ill, he was suffering from typhoid and got complicated, and he died in Bangalore only. And he had to bring the dead body in the ambulance all the way from Bangalore till Belgaum. He had to bring his dead body here, and he was one of his closest friend. He was a best friend, bestie. Both of them together were working on that project. And then he told I had to bring him, and then from Bangalore till Belgaum. And since then, I every night I see him in my dreams, and actually it is not a dream. He literally calls me, and he tells के तू भी आजा इधर बहुत अच्छा है. And he was giving this case history, a very smiling face, not a single sign of sadness on his face. And he told, I'm like I'm missing him a lot, but every day he comes and he calls me, come here. And then he was laughing at that. I literally got goose flesh on my this thing. And then I said, okay, fine. I was actually shivering because rarely you get to know. We have in throughout 25 years of my medical practice, we have some case stories of patients which we cannot forget actually. And then he told me that, and then I said, okay, fine. And he told me that till 12 o'clock and till 1 o'clock he sits in the graveyard. There are 4 brothers. Until 12 o'clock he sits in the graveyard, and his, one of the brother has to come and take him from the graveyard at 12 o'clock. And because of this reason, he told that his father has neglecting him. He is neglecting him. He doesn't like him. Moreover, he is not earning nowadays because that project he failed there. And he told that I eat morning. You give me any amount of food, I can eat. 10 eggs, 10 chapatis, like that. So he was emotionally very much disturbed, and he was actually, to diagnose this, he was in a nervous shock of losing friend. Nervous shock of losing friend. So here I considered that history of grief, history of disappointment, history of love and affection, disappointed affections. So considering that, I just gave him phosphoric acid. First I thought of natriumur, but then more than natriumur, his constitution was towards phosphoric acid. Because phosphoric acid is one of the remedy for insomnia. So with what he was presenting was loss of sleep and insomnia. So I had to consider that particular symptom first. Other than insomnia, he was not having any complaints. He was very robust because he was consuming a lot amount of food. So I gave him phosphoric acid 200, only 1 dose. And first time I did not give him any medicine for external medicine for hair loss. And I told him, phosphoric acid 200, 1 dose or 3 doses, I don't remember. And rest of the days, 15 days PL. And for my surprise, he was back within a week only. He came for the follow-up after 1 week. And I said, I had given you the medicine for 2 weeks. As soon as he came, he asked me first question. Doctor, did you give me homeopathic pills for, you know, sleeplessness? Sleeping pills? Did you give me sleeping pills? Either he told me, तुमने या तो स्टेरॉइड दिया है या तो स्लीपिंग पिल दिया है. Then I said, why? Then he told that now I can sleep. He told that I am sleeping without the sleeping pills. So that was the effect of homeopathic remedy, the way it acts in dynamic form. And when you consider what is important in your patient, that is very, very important. What needs to be treated in your patient, that is very important. So what was supposed to be needed, if you see, here the cause is disappointed affection and shock. He was in a shock because of sudden death of his friend, right? So that was in brief about, how are you supposed to treat a patient. So you must know that what in your patient, what you have to treat first. Yes, then only you can treat the patient. Otherwise, with homeopathy, though, you can't treat anything because we don't have any palliative remedies, right? So that was the thing. So long succession of moral emotions, injuries, operations, drug abuse after illness. So most of the causes were what belonging to phosphoric acid. So that is how I cured that patient. I tell you, he was very happy. He got married. He has children also. Coming to the mental symptoms, ailments from grief suffers in silence. Ailments from grief suffers in silence, softening or a dropping down in tone on the emotional plane, leading to indifference, apathy, wants to be left alone. So even this symptom also I found that he wanted to sit in the graveyard next to his friend's grave. Sleeps with face to the wall, listless, apathetic, indifferent to affairs of life, prostrated and stupefied with grief to those things that used to be of most interest. Affections of mind, especially of emotional side and brain fag. Frozen down emotions, indifferent to any kind of stimulation. Answers slowly, slowness, slow grasps, can't collect his ideas, hunts for words. So you find the image in this, the image of some acids, other acids, as well as its, phosphoric acid's own some symptoms. Forgetfulness and weakness of memory, especially for the birds. Delirium, muttering, lies in a stupor, lies like a log, when aroused is fully conscious, answers slowly and correctly and relapses into stupor. Quite unwilling to speak or hasty speech. Mental debility first and then physical debility. He is so tired in mind, perfectly exhausted. In chronic diseases, when brought on from long study, prolonged worry in businessmen, in feeble schoolgirls who become relaxed from very little efforts. In acute diseases, he, especially in typhoid fever, is averse to speaking or answering questions. He merely looks. Intolerance of noise, especially music, which causes stitches in the ear even while singing himself. Every second re-echoes loudly in the ear. So you see, he suffers from brain fag as that of the other acids. He also suffers from weakness of memory and especially weakness for the words, weakness of memory to recollect the words. Coming to the guiding features, suited to the persons of originally strong constitutions who have become debilitated by loss of vital fluids. Children and young people who grow too rapidly. Same thing I found. He was very tall and hefty and strong. Weakness and debility with free secretions, profuse urine emissions, sweat aggravated at night except diarrhea, which is non-debilitating. Now this symptom is very, very important. You can underline it, that patient in phosphoric acid, you find mental debility first, then physical debility, unlike your muriatic acid. So many times the comparison is asked between muriatic acid and phosphoric acid, whereas, or otherwise even sulfuric acid, whereas you see in muriatic acid, the mental, the physical debility comes first, whereas patient is mentally very sound, whereas in phosphoric acid, Physical debility is later, whereas mental debility comes first in case of phosphoric acid. Mental debility like brain fag and exhaustion and weakness of memory comes first, whereas he is physically very strong initially. So what you find, even he suffers from diarrhea, frequent loose motion, but still he doesn't feel weak. That is the peculiar symptom of phosphoric acid. Even though he suffers from diarrhea, but then diarrhea which is non-debilitating, debilitating. For example, usually a patient who suffers from loose motions, after 3 to 4 loose motions only a patient feels weak, whereas if it is phosphoric acid, and you may be having some other drugs also, but phosphoric acid doesn't feel weak initially in cases of diarrhea also. Pinching and squeezing pains he suffers from. Sleep by day but wakeful at night. Sleep is deep but when aroused fully conscious. I told you the story also that he used to see his friend calling, literally he used to see. Craving for refreshing things, juicy things and fruits and cold milk. The remedy runs from the mental to the physical, from the brain to the muscles. Phosphoric acid has also great physical weakness, so tired in the back, so tired in the muscles, so tired all over, a paralytic weakness. Later, there is sexual impotence, aversion to coition, loss of sexual desire, no erections, penis becomes relaxed in the midst of the embrace, and he cannot finish the act. Ailments from business and cares. Prolonged grief, young woman suffering from unrequited affections or from the loss of a loved one. Some suffer more intensely than others, some seem more philosophic. Ailments from care, grief, sorrow, chagrin, homesickness or disappointed love, particularly with drowsiness, night sweats towards morning and emaciation. So here ailments from grief. Now as far as ailments from grief and sorrow and disappointed, you can compare directly phosphoric acid directly with natriumur, and in fact phosphoric acid is chronic of natriumur. As far as when you give importance to the ailments from sorrow and grief and disappointed affections, etc. From the beginning, the mental state has been most marked, and finally comes the muscular weakness, which increases until the jaw drops, and it seems that the patient must die of exhaustion. Such states of weakness may come on from hemorrhages. It checks the hemorrhages. There is a state like anemia, pale lips and tongue, face, hands, and feet waxy. So, as like that of the other acids, phosphoric acid can be indicated for hemorrhages, particularly from the internal organs, or what you can say is concealed hemorrhages. Concealed hemorrhages, so you have got two types of revealed and concealed. Concealed are internal hemorrhages like that of from the stomach and lungs, etc. The patient pines and emaciates, grows weaker and weaker, withered in the face, night sweats, cold sweats down the back, cold sweats on the arms and hands more than on the feet, cold extremities, feeble circulation, feeble heart, catches cold on the slightest provocation and it settles in the chest, dry hacking cough, catarrhal conditions of the chest, tuberculosis, pallor with gradually increasing weakness and emaciation. So last three slides, you can see how phosphoric acid patient definitely suffers from chronic diseases which run from the mind to the body. So initially he is weak mentally. He starts, after the exposure to causation, such causations which I told you. Initially he starts with, he goes into mental shock and suffers from brain fag and weakness of memory and mental exhaustion, etc. And later he definitely, like other acids, suffers from debility, which is same as that of your arsenic and muriatic acid. During this weakness, there is vertigo. Vertigo while lying in bed seems like floating while lying in bed. Limbs seem to be lifted up while the head does not seem to move, as if the limbs were floating. The phosphoric acid diarrhea often ameliorates many of the symptoms and the patient feels better. This is a keynote symptom you can underline. That is, diarrhea relieves phosphoric acid patients most of the complaints. He feels better by diarrhea. He feels better by diarrhea. Not only that, He doesn't feel weakness even despite suffering from diarrhea, but in general also he feels in general better when the diarrhea is out. Nervous state marked indifference, weak and trembling, fainting, great nervous exhaustion, and hysterical affections also. Coming to some of the complaints of the head: headache of schoolgirls from eye strain, of students who are growing too fast, from long lasting grief. Now, see, students who are growing too fast. Now, this it has gained this property of growing rapidly from phosphorus. If you recall what you have read in phosphorus, phosphorus is remedy indicated for patients who are extraordinarily tall, who grows very fast at puberty. Now the same it has borrowed from phosphorus. Phosphoric acid has borrowed this tendency to grow too fast from phosphorus, right? So here headache from long lasting grief or exhausted nerves, congestive headaches in schoolgirls from slight exertion of the mind and use of eyes, periosteal pains, bones ache as if scraped, ameliorated by motion. When lying, the pain shifts to side lain on. Pain goes to the side lain on in the sense pain goes to the side lain on in the sense if he is lying on the right side, he suffers from headache on the right side. When he lies on the left side, the headache turns towards left side. Hair, falling of the hair, even from the eyebrows and genitalia. Hair becomes grey. So phosphoric acid is one of the remedy for baldness, premature baldness as well as premature graying of hair. So especially for hair falling, phosphoric acid is a first great remedy. Eyes, sight confused as if looking through a mist, dull sunken eyes with blue circles. Face is pale, sickly face, white or egg seems dried on it. White of egg seems dried on the face is the symptom of sulfuric acid also. Mouth is red, stick in the middle of tongue, sores on the teeth, bleeding swollen gums. Dry mouth with thirst. Diarrhea, profuse, painless, dirty, white, watery or lentic stool. Odorless, non-debilitating, involuntary diarrhea escapes with flatus when moved in children. Painless, not exhausting diarrhea, though long-lasting, and this diarrhea is aggravated in summer season. So, non-exhaustive and painless diarrhea is phosphoric acid. Coming to some of the symptoms belonging to gastrointestinal system, in phosphoric acid, there is often an amelioration of complaints by the ending in diarrhea. Copious thin watery stool, from the quantity it would seem that the patient would be exhausted. Child with copious watery stool in summer, so copious that the napkin seems to of no use. The stool runs all over the mother's dress and on the floor, forming great puddles. The stool is almost odorless also. Thin and watery, and the little one smiles as if nothing but them mattered. The mother wonders where it all comes from, and yet the child seems well. The phosphoric acid diarrhea often ameliorates many of the symptoms and the patient feels better. Chronic diarrhea, copious, thin and watery, whitish grey, and the patient feels comfortable, free and happy. If the diarrhea slacks up, the patient is worse and on come symptoms of tuberculosis, weakness, prostration, brain fag, etc. Some patients say they are never comfortable unless they have diarrhea. In phosphoric acid, the stool is whitish grey like dirty white paint. In podophyllum, it is yellow. So you can compare phosphoric acid diarrhea with definitely podophyllum diarrhea, which is also painless, profuse, isn't it? In case of excuse me, in phosphorus in podophyllum also, you see podophyllum is a remedy for diarrhea, which is associated with 5 P's, you can say. So diarrhea which is profuse, painless and putrid, associated with prolapse of uterus, and 4 P's or 5 P's, that is what. And prostration, definitely. You see in podophyllum prostration associated with diarrhea, whereas you don't see in phosphoric acid. Abdomen much bloated, tympanic, great soreness of the bowels as if in a typhoid state. White or yellow, watery diarrhea, chronic or acute, without pain or any marked debility or exhaustion. It is uncommon for the stool to be yellow when watery. It is yellow when it is mushy. When watery, it is light colored, sometimes even milky stool. When yellow, it is like cornmeal mush, pappy, as in typhoid states, thin like thin mush. Diarrhea not prostrating after catching cold during heat of summer. Watery, chronic, violent, bilious or mucus of 20 months. Standing has the appearance of an old man from acids in young person who grow too rapidly after eating undigested greenish white paleness. It is also one of the remedy for fever. Its use in low fevers must be studied. The complaints come on slowly, slow decline, slowly increasing prostration. Such appearances as are found in advanced typhoid. Yes. Phosphoric acid can be also one of the remedy which is indicated in typhoid fevers. That is why it can be compared with muriatic acid in typhoid fever, whereas in muriatic acid, the physical debility comes first in typhoid and mental debility comes later, whereas in phosphoric acid, the mental debility comes first and physical debility comes later. So, as you know, typhoid is a debilitating fever. It has the prostration, tympanitic abdomen, dry brown tongue, sores on the teeth, gradually approaching unconsciousness. Little thirst increasing to intense thirst with craving for much water during perspiration. Wants to be let alone. Looks at the questioner with glassy eyes as if slowly comprehending the question. Pupils contracted or dilated. Eyes are sunken, Hippocratic countenance. Continued fever, bleeding from the nose during fever, bleeding from the lungs and bowels from during fever, hemorrhages from any mucous membrane during fever, sunken about the eyes, discolored lips covered with sores, becoming very black, prostration gradually increasing. So, picture of typhoid associated with mental debility first, then physical debility, tendency for hemorrhages, etc. You can read male sexual organ symptoms. Phosphoric acid is one of the remedy which can be indicated for weakness of the male sexual organs. Female complaints: phosphoric acid produces a troublesome leukorrhea, yellow, mostly after menses, with itching, profuse yellow, thin, acrid mucus with chlorosis. It suits the woman who has been nursing her child a long time or nursing twins and who gives much milk. She becomes tired and weakly, loss of fluids, blood prolongedness, uh, uh, fluids and loss of blood, prolonged nursing and weakness from such causes. Extremities: limbs and joints become affected, pain in the hip joint, pain in the long bones between the joints, better by motion. It is also one of the remedy for old gouty constitutions. Tissues become weak, red spots appear wherever the flesh is thin over the bones, and these spots become inflamed and form open ulcers. After fever, abscesses in the muscles and state of molecular weakness about the ankles over the tibia where the flesh is thin. Phosphoric acid has a special relation to the periosteum. It is one of the remedy for periostitis, pains in the tibia at night, bone feels as if scraped, cold hands and hot feet, ulcers on the legs with watery offensive discharges. So phosphoric acid can be one of the remedy for osteomyelitis myelitis like conditions as it contains phosphorus in it. The hair and skin. Falling out of hair is a striking feature. Falling of the hair from the genitals, whiskers, eyebrows, head. It is closely related to natremure as far as baldness is concerned, as well as selenium in falling out of hair. Selenium has falling out of the hair from the head, eyebrows and lashes, beard and genitals from all over the body. Natremure causes the hair to become very thin during confinement. The hair falls from the genitals. So there is one condition called as alopecia diffusa. In the sense, patient starts losing hair from all over the body, from the eyebrows, from the skin and from the genitals, which is due to autoimmune deficiency, and phosphoric acid is one of the remedy for hair fall or diffuse alopecia, where patient has got hair fall from eyebrows as well as from even the body as well as etc. So phosphoric acid, which is due to deficiency of the immunity or autoimmune disorders, phosphoric acid is one of the remedy for that. And not only that, phosphoric acid has got very important action on the skin as it is an acid, and mixed with phosphorus, you can see that it has got tendency for boils, abscesses, pustules, and other moist eruptions. Suppurating eruptions, tissues become weak. Creeping, tingling, and crawling all over the body, especially where there is hair, as if in the roots of the hair. Formication, especially in those debilitated from sexual excess. Formication over whole body. Sore spots in the spine, lame back, and backing. Itching between the fingers or in the bends of the joints or on hands. Herpes, eczema, erysipelas, large purple spots form on the skin, and extra vesication of blood from the capillary veins. Ecchymosis also. Ulcers on the skin, carbuncles, warts, chilblains, veins, corns with stinging and burning, and parts become black. Feeble circulation in the skin. Skin is withered, old and grey it becomes, and the patient emaciates. Some of the complaints related to the urinary system: milky and profuse phosphaturia, and it is also one of the remedy for true glycosuria. In the sense, phosphoric acid is one of the best remedy for diabetes. It is one of the best remedy for diabetic patients, especially who do not feel very weak, but then particularly when they throw out their symptoms on the skin. So it is one of the remedy for diabetic wounds, diabetic eruptions, diabetic abscess, because it is phosphorus plus it is an acid of phosphorus. So phosphoric acid can treat a patient of diabetes who is manifesting on the skin with boils and as well as diarrhea, who frequently suffers from diarrhea and who suffers from diabetic wounds. Enuresis in the first sleep. Bones, it has got action on the bones. Interstitial inflammation of the bones, formication along the spine, pains at night as if bones were scraped, growing pains, great fatigue after walking. So keynote symptoms: apathetic, indifferent, listless, ailments from loss of vital fluids in the form of diarrhea, in the form of profuse menses, etc., and then in the form of, even in males, some anal emission. A patient is relieved by short sleep. All discharges are profuse and debilitating except diarrhea, headache, etc., etc., as you have already read there. Nucleus of the remedy: sensorial depression as a result of depressing emotions, grief, loss of vital fluids, weakness and debility with free secretions, profound mental debility followed by physical debility. Best suited to originally strong constitutions who have become weak or debilitated by a long succession of moral emotions, loss of vital fluids, sexual excesses, or vital acute diseases. Clinically useful in relieving pain of cancer, typhoid when other symptoms match. Phosphoric acid has more than once proved curative in purpura and passive hemorrhages. Say Dr. Tyler, phosphoric acid excels in diabetes where the starting point of the disease was in nervous system, is told by Dr. Richard Hughes. For post-influenzal nervous asthenia, says Dr. D.M. Boland, in chronic affections following sorrowful experiences with phosphoric acid dilution, 6x are told by Dr. Beta Gumpers. For falling of the hair from debility after fevers, phosphoric acid works successfully, told by Dr. Hughes, and it is one of the remedy for diabetes. Remedy relationship: it is complementary to China, Ignatia, sulfate. You can compare it with aurum, gelsemium, etc., etc. In typhoid fever, you can compare phosphoric acid with phosphorus, pulsatilla, picric acid, silicium, muriatic acid. In apathetic stupor and delirium, you can compare it with nitric acid compound. It acts well before or after cinchona in colliquative sweats, diarrhea, debility. It is can be given after Naxomica in fainting after a meal. So that's all about phosphoric acid. Thank you very much. Take care.